Well, a warm welcome to this talk. Now, today we're going to be looking at something very important, metabolic reset. And we're going to be hearing from the channel's favourite cardiologist, Dr. Malhotra.
For well over a decade, I have been managing many patients to help them improve their lifestyles and reverse risk factors for heart disease linked to obesity, such as high blood pressure, type 2 diabetes. And what I found through my research and my own clinical experience, just within weeks of dietary changes, many of those conditions can even be reversed or sent into remission.
And as you see from that teaser there, Dr. Malhotra is currently last week was in the United States for the inauguration. And I think we can say is tipped for a post in the new administration, which could have tremendous implications for American health. Now, this is Dr. Malhotra's website here. Metabolic Research, and you can go on there and it's you can look up the evidence base, for example, and you'll find out that metabolic reset is vitally important for about 140 million people in the United Kingdom and the United States, but applicable to everyone because we have so much metabolic disease, the obesity, the hypertension, and all the complications that come from these conditions, diabetes, strokes, heart attacks, peripheral vascular disease, are all related to this vital metabolic health concept. So let's dive straight into it now. Do try and stick with this video because there's some really important stuff in it. So metabolic reset. We can all reset our metabolism according to Dr. Malhotra and the evidence he gives. And tantalizingly, a key role in the National Institutes of Health. What implications is this going to bring? Potentially immense implications for the future. And when the United States starts getting its act together, as I believe it will, it's going to give us immense research data and ammunition to change lifestyles around the world. So really quite an exciting time. And we're hopefully going to be following this, and Dr. Malhotra is going to keep us up to date as well. Big changes probably ahead in terms of global health. I won't get distracted on that now. Let's stick to the point. Now, Dr. Malhotra says if an item comes out of a packet and it contains 5 or more ingredients, then it's not allowed. In other words, it's ultra processed food, which we don't want. So unprocessed food is food that looks like food, so you can recognize it as part of an animal, or it looks like a plant. That's completely unprocessed. Partly processed might be something like putting beans in a tin. But then when we have ultra processed food, it's food that comes out of a factory and contains 5 or more components on the label, and it's been jiggled around with, it's being processed often through high temperature processes, often with things like emulsifiers and colours and additives put into it, things that our hunter-gatherer ancestors would never have heard of, let alone ever considered eating. Right, there is nothing natural or healthy about items like that. So this is not what we want to be eating. So he says, look for a short ingredients list. Food has been through very little processing. And I would add low temperature processing as well. High temperature processes can change oils and all sorts of things. So looking for cold pressed things like cold pressed olive oil is a good idea. Minimal processing, preferably at low temperatures, is what we want. Now, studies suggest the more processed food in your diet, the more processed your diet is, the higher the risk of conditions like diabetes and high blood pressure. So eat a lot of this high processed food, suffer the metabolic consequences, is what the research is indicating. And this only affects 140 million Brits directly. And of course, it potentially affects us all. Now, Dr. Malhotra's patients have reversed their pre-diabetes, lowered their blood pressure within 28 days on the diet. It doesn't involve calorie counting. We don't want people to feel hungry. What are the components? Well, all sugary and carby foods that lack fibre are banned, at least for the first month or so. So the idea is, in Dr. Malhotra's thinking here, is that you go on a fairly restrictive diet for a month or two. That resets the metabolism, and then you can gradually normalise to an extent, although there are going to be some changes that will need to be lifelong. So it's not about counting calories, no need to be hungry. But all sugar, carby foods that lack fibre are banned. So we don't. The idea here is we reduce sugars and carbohydrates. Sugars, try and cut those out altogether as far as possible. Certainly, overt sugar like cakes and biscuits and fizzy sugary drinks would be banned. And we want to cut out carbohydrates, especially the white carbohydrates like white bread, white rice, white pasta. But if you're eating carbohydrates that's associated with fibre, they're absorbed much more slowly, and they are allowed, although we do need to restrict carbohydrates quite a lot for the first month or so of this diet. But, I just love dates, for example, which are quite sugary, but they're also very fibrous. So that's kind of more allowed, eating the fibre. Having said that, some fruits are very sugary. Mangoes, bananas are very high in carbohydrates. Others contain equal amounts of fibre but less sugars. But these are principles anyway. All sugary carby foods that lack fibre are banned. So sugar, white bread, pasta and rice we don't want. And if we do have these, they should certainly be brown with fibre in them. It's for sugar addicts like I used to be, who need to snap out of their addiction to junk food and reset their metabolic health, says Dr. Malhotra. And I was certainly addicted to carbs as well. I'm still struggling with it to an extent, but I'm much better. And I don't crave sugar anything like as much as I did. Dr. Malhotra was actually on 40 teaspoonfuls a day. So one of the chief of sinners himself, who's now in great shape having cut that out. That takes quite a bit of eating, actually, 40 teaspoonfuls a day, but that's what Dr. Malhotra says he was consuming. He only recommends to follow it for a month or so. After that, people can slowly reintroduce carbs at the weekends. And the principle is kind of 80-20. So, have a fairly low carb diet for 80% of the time. And I got this in a private conversation, but he did tell me that he has the occasional biryani or pizza. So that's okay. That's okay. You can do that. But it's how you behave most of the time that's going to be important. Dr. Malhotra says, I know stuff like this works. I've been doing it for years, recommending it to my own patients too. So this is based on extensive clinical experience as a cardiologist with a special interest in metabolic health. So one of his patients, after 4 weeks, lost 11 pounds. That's just under 5 kilograms. He put his type 2 diabetes into remission. Incredible. Another person aged 51, all of their joints pain disappeared when they cut out bread, carbs and cheese. I'd struggle to cut out cheese. Most people wouldn't need to stop cheese because it's high in protein, high in fat and very low in sugar. Now, Dr. Malhotra is working with dietitian Kim Pearson. And this is basically on the Mediterranean diet, which of course we know is healthy. So it's plant-based foods, healthy fats, some fish, olive oil and raw nuts, things like that. Tomatoes, olives, Mediterranean type foods. We pretty convinced this is a healthy approach to diet. Now, practically, breakfast, berry smoothie or vegetable omelette would be good. One possibility there. Berries, for example, high in nutrients, vitamin C, vitamin K, vitamin Bs, potassium, magnesium, antioxidants and fibre. And I know another friend of the channel, Dr. Sunil Dand, is very keen on blueberries as well. Preferably grown without pesticides and all the junk that can be added to the agricultural processes as far as possible. These are just some ideas, really. Lunch, protein salad plus limitless veg. Eat all the veg you want. Veg is good. Big piles of vegetables. Evening, stir fry with Japanese noodles or meatballs, or vegetable spaghetti is a possibility. Eat 3 meals a day. Leave 4 to 5 hours between each sitting. My trouble is snacking. I'm working on it. Cutting out snacks is really quite important. And then having, of course, a good few hours off overnight, 14 to 16 hours, to allow the digestive system to recover. Interesting. Very consistent with Tim Spector and the Zoe ideas. So we're getting these ideas coming together. I don't want to misquote Professor Spector, but I think this is largely consistent with his thinking, especially the intermittent fasting. Sunil Dand, Asim Malhotra. These are leading doctors in the field who seem to be coalescing around common views, although I'm sure Professor Spector would add things like fermented foods. There's always extra bits. Now, we do need to learn some skills in the kitchen. It may cost more in the short term. This is true. There's no getting away from the fact that healthy eating in the short term can be more expensive because junk food contains a lot of calories that are dirt cheap. But we should be eating at least 5 vegetables and pieces of fruit a day. But also, I find just going to local supermarkets and markets and sometimes farmers markets, if you buy vegetables seasonally, it's sometimes possible to get them remarkably cheaply. So it's just a matter of keeping your eye open for a bargain and stocking up on a week's worth. And I'll make like if I get some leeks soup, leeks cheap, I'll make a huge pan of leek soup with them all, and that'll do for 3 days if you keep it in the fridge. So seasonal vegetables can be very, very cheap actually. It doesn't necessarily need to be more expensive if you are a sensible shopper. Now, diet sodas are banned, so all these zero drinks, we don't want those. What we want to do is get rid of the sort of when you drink these things, they taste sweet and your body kind of responds appropriately. Plus there's question marks over a lot of these artificial sweeteners. But the point is we need to re-educate the palate to get away from the sweetness, and you can do. I mean, I remember when I was younger, I was about 15, I stopped taking sugar. I decided one day I'd stop taking sugar in my tea, so I just stopped taking sugar in my tea, and it was awful. But then within a week or two, I could taste the sweetness from the lactose in the milk. You sensitize your palate. So it's a case of getting rid of this sugar craving, very sweet tooth type palate. And there is a degree of palate re-education that is required, but it does work really quite quickly. So diet sodas would be considered processed with additives that have the potential to compromise health. Fake sugars perpetuate sweet tooth cravings. These cravings, we can get over them. We do get over them. We want to work with people to unsweeten their sweet tooth and attune their palate to whole foods, says Dr. Malhotra. Now, alcohol. This protocol suggests consuming 3 small glasses of dry white wine or 7 single measures of white spirit. And I would add that, of course, this is per week, not per day. Alcohol, again, addictive, very addictive. Many people, like me, for a long time were addicted to alcohol. Not that I was lying around drunk in the gutter every weekend, but it becomes a regular thing. It becomes a habit, and there's a level of dependency there, and that can be broken. It can be broken. My drinking's now massively reduced. For 6 months last year, I didn't drink at all. It can be done, and the cravings do go down. A lot of it's habit as well. Of course, alcohol is calorific, so if you cannot drink, fine. If you need a little bit to drink, then okay, you can have a little bit to drink, is the message. If you don't drink already, whatever you do, don't start. So alcohol in moderation, if you need it. Miss Pearson, we want to ensure that the plan is sustainable for people long term. This is about long-term changes. And for many, the ability to have a couple of glasses of wine a week is something they enjoy. So, okay, that's okay. Dr. Malhotra. Now, this, along with Robert Kennedy, I think, doesn't suggest a junk food ban for America. We're not telling people what to eat. I'm not telling you what to think. This is empowering your thinking. So it's not about controlling the food supply. That would be totalitarian. I don't think anyone would agree with that, apart from the practicalities. Doesn't suggest junk food for a ban for America or the UK. Rather, this is to kickstart new habits. Let's get into better dietary habits and get rid of this metabolic disease that's affecting 140 million of us. Simple switches, for example, eating burgers without buns, and there's other ones suggested. One of his investigations found bread contained 50 additives. I mean, bread. You know, you can make, like I made some simple flatbread the other day just with self-raising flour, a bit of yogurt, a bit of milk, and that's fine. It's just those components. But very often bread is an ultra-processed food with loads of components. It's really hard. I found one bread I can buy regularly in the supermarket, and even then that's not always there, that doesn't have emulsifiers. I don't want to eat bread with emulsifiers. They're not good for you. But it's very hard to get bread without emulsifiers because bread is often an ultra-processed food when it doesn't need to be, unfortunately. So re-educating shoppers as well as re-educating the palate, I guess, is important. So the 80-20 rule is behave yourself 80% of the time, have a pizza or a biryani or something 20% of the time. And I think this fits in with RFK Jr.'s Bobby Kennedy's policy. He wants to ban some pesticides, which of course we would agree with. It needs to investigate food additives, seed oils, especially the the ones processed at high temperatures, some ultra-processed foods, make America healthy again. Plan is to provide families with safe food, end the chronic disease epidemic plaguing our children, the appalling levels of obesity. Ingredients which are either banned or heavily regulated in Europe need to be reviewed in the United States. Not that we're that good in Europe, but America, about 70% of calories come from ultra-processed food, which is not the way to go. And the metabolic price in ill health is paid for that by hundreds of millions of us around the world. So massively important topic. I'm going to play the full clip from Dr. Malhotra now. I obviously everyone needs to make a living. I have no financial interest in this whatsoever.
For well over a decade, I have been managing many patients to help them improve their lifestyles and reverse risk factors for heart disease linked to obesity, such as high blood pressure, type 2 diabetes. And what I found through my research and my own clinical experience, just within weeks of dietary changes, many of those conditions can even be reversed or sent into remission. More recently, I did a pilot program with nutritionists from Harley Street called Campbell, and over 4 weeks we managed hundreds of patients who were able to even reverse type 2 diabetes, which many people will find quite extraordinary, but we were not that surprised. We're now scaling this up with a program that we want to make affordable for people. It's going to empower them. They're going to learn about cholesterol, statins, high blood pressure. We're going to give them diet plans with recipes. It's called Metabolic Reset, and you can sign up for a £55 joining fee, and then followed by £25 a month, less than a gym membership, to get access to all this information, because we want to make it accessible to as many people as possible. We've had some great coverage already in the Daily Mail, and I am here in Washington DC at the moment to help support my friend Robert Kennedy Jr. and the Trump administration in the process of making America healthy again.
But you can certainly look around the website, look at the article references I've put in, and it's all really quite interesting and actually pretty commonsensical, really. You know, I've given dietary advice all my life based on guidelines. A lot of that's turned out to be wrong. But now these simple combinations of food, like putting some extra virgin olive oil on your salad, the combination of foods we know just works. It's sensible eating of proper food. But yeah, we have the potential to improve the health of hundreds of millions of people. Hopefully going forward, data on this will be collected in the United States, and then this will become unambiguous. But for now, thank you for watching.